Hey everyone, I'm Mehdi. Today, we're taking a deep dive into one of the most incredible structures in the entire body, the hip joint. But forget those dry anatomy lessons from a textbook. We're going to look at this thing for what it really is, an absolute masterpiece of natural engineering. So, let's just start with the big question, right? Think about it for a second. Every single time you take a step, whether you're walking, running, or climbing stairs, this one joint is handling massive forces. So how on earth does it do that without just failing? Well, that's the engineering puzzle we're going to solve together today.
Okay, so its number one job, its primary function, is to support the weight of your head, arms, and trunk. In biomechanics, they just call this the hat for short. Basically, it's the central pillar holding up your entire upper body, whether you're just standing around or you're on the move. So, how does it pull off this incredible feat of strength? Well, the answer really starts with its most basic design. So let's take a look at the architectural blueprint, the classic ball and socket.
Here are the two stars of the show. You've got the ball, which is the head of your femur, that's your thigh bone, and it fits perfectly into the socket, which is a cup-shaped part of your pelvis called the acetabulum. It's the simple, elegant design that gives your hip its amazing range of motion.
And let's get a closer look at that socket. You know, the acetabulum isn't just one single bone. It's actually formed where three different pelvic bones, the ilium, ischium, and pubis, all meet and fuse together. This creates this incredibly deep and secure anchor point for the whole joint. Now, in engineering, you always have design specs, right? And the hip is no different. This right here is the center edge angle. A really easy way to think about it is like the overhang on a roof. A good overhang keeps the rain out. Well, a good CE angle means the socket gives plenty of coverage over the ball, keeping it super secure. If that angle is too small, there's not enough overhang, and that can lead to instability and some serious problems. And the design gets even cooler. Right around the rim of that bony socket, there's a ring of fibrocartilage called the labrum. You can think of it like a flexible gasket, or maybe even a suction cup. It does two things. It makes the socket deeper, and it creates this negative pressure seal that literally sucks the ball into place. It's just a fantastic extra layer of stability.
Okay, so we've got the bones, which are like the hard architecture. But what about the soft architecture? Let's check out the amazing support system that holds this whole thing together.
I absolutely love this analogy. The ligaments wrapped around your hip aren't just dumb ropes. They're more like intelligent guy wires, like the ones that hold up a huge tower. They are tensioned so precisely that they provide incredible strength right when you need it, but they also know when to slacken off to allow for all the movement you need.
And you can see here just how strategically those wires are placed. The whole joint is wrapped in this tough, fibrous sleeve called the capsule, and that capsule is reinforced by three main ligaments, two on the front and one on the back.
And get this, each one has a very specific job. The iliofemoral ligament, which is shaped kind of like a Y, is actually the strongest ligament in your entire body. Its main job is to stop your hip from extending too far backward when you stand up. It's this crucial stability check that happens every single time you push off the ground. The other ligaments jump in to prevent too much movement in other directions, all working together like this dynamic web to keep the joint stable.
All right, so we've seen the outside structure, now let's go inside. Because honestly, the most amazing part of the hip's design isn't what you can see on the surface, it's how it's built to handle the insane forces happening on the inside.
So here is the core physics problem of the hip. When you stand, your body weight, remember the hat, is pushing down on the head of the femur. At the exact same time, the ground is pushing back up through the shaft of the bone. That's the ground reaction force. These two forces going in opposite directions create this powerful bending force that is constantly trying to snap the neck of the femur.
So how does nature solve a problem like that? How do you reinforce something that's always trying to bend and break? Well, the solution isn't to add more support on the outside. The answer is literally woven into the fabric of the bone itself.
And here it is. This is what the inside of the femur looks like. These lines you see are called trabeculae. They're these tiny struts of bone that create an internal scaffolding. And what's absolutely genius about them is that they aren't random at all. They line up perfectly along the lines of mechanical stress. It's like nature's own rebar, reinforcing the bone exactly where it needs it the most. This internal scaffolding is basically made of two systems working in tandem. You've got the medial system, which is made of these vertical columns that fight against the compressive or crushing force on the bottom of the femoral neck. Then you have the lateral system with these arching bands that resist the tensile or pulling apart force on the top. It's just an incredibly elegant internal solution to that big bending problem.
But, like any piece of engineering, even this masterpiece has its limits, its potential flaws, and some very specific weak points. So let's take a look at what happens when the design specs are a little off or when we put the joint in a position where it's not at its strongest.
So on the left, you're seeing a pretty normal angle for the femoral neck. But check out the X-ray on the right. This is a condition called coxa valga, where that angle is way too large. This change in the design specs totally messes with the joint's mechanics, and over time that can lead to instability and a lot of wear and tear.
Okay, now this is a really subtle but super important point. The hip's most stable position is when you're just standing up straight. This is what we call its close-packed position, where all those ligaments we talked about are pulled tight. But that's not the same as its most congruent position. That is, the position where the ball and socket have the most surface area touching each other. That actually happens in the frog leg position. And understanding this difference is the key to figuring out the joint's biggest weakness.
So if the most stable position is standing straight, what's the least stable? What is the hip's most vulnerable position? The one where it's at the highest risk for something bad, like a dislocation? The answer is something a lot of us do every single day. The hip is at its most vulnerable when it's both flexed, so bent, and adducted, meaning pulled in toward the middle of your body. And the most common example of this? Just sitting with your thighs crossed. In that position, the head of the femur isn't fully covered by the socket, the ligaments are slack, and the joint is surprisingly unstable. So there you have it. We've seen the blueprints, the amazing support systems, and the brilliant internal architecture that makes the hip a true engineering masterpiece. So the final question is really for you to think about. Now that you understand how it's designed, are the ways you move every day actually protecting that design? Something to chew on. Thanks so much for watching.